Good evening, everybody, and welcome to tonight's webinar, Steps to Reduce Disease in Newborn Calves. I'm Ellen Crane, Extension Coordinator for the BCRC, and I will be your moderator for tonight. This session will last approximately 1 hour, but may go longer depending on the number of questions you've got for us later on during the question and answer period. If you are on Twitter, you can tweet along with us using the hashtag BeefWebinar. We are recording this session tonight, and I will email out the link of the recording to everyone that registered in a couple of days. So if you missed hearing anything tonight and want to watch it later, you can. Of course, you'll be able to hear and see tonight's presenters, but we can't hear or see you. If you want to communicate with us, type into the small chat window in the control panel near the top or the bottom of your screen. If you have a question or comment for me or our presenter, that's the place to do so, and feel free to type in questions at any time throughout the presentation. And we'll answer all of your questions near the end of the hour. If your interconnection is a bit slow tonight, it might help to close other programs that are using the internet, and as well as close your webcam window, which means you won't be able to see us, but hopefully you'll be able to at least hear the presenters. And it should help the slides load a bit faster for you. And with that, let's get started. This is what we will be covering this evening. First, I will go over briefly on how to use the new BCRC search tool. And then I'll hand things over to Dr. Steve Hendrick to talk about steps to reduce disease in newborn calves. And after that, we'll go through a question and answer period. So before I hand things over to Steve, I'll share my screen. And I'll just check in with Steve. Steve, can you see the beef research page okay there? Yes, okay. Thank you. Okay, so we recently updated the BCRC website to make things a little bit easier to find. So we revamped the BCRC research tool that we have here in the top right-hand corner. So if you ever visit our website, you can find your search bar up here in the top right. So let's say you had a particular topic you were interested in. Let's say tonight that we're looking for forages. So it helps if you're looking for more of a general topic instead of looking too specific, but I'll show you here in a second. So I typed in forages. So before it used to give you a full page of all the results, but now you can filter your results based on what you're looking for. So if you're looking for blog articles, if you're looking for research fact sheets, or you're looking for a topic page, you can filter these out. Or if you're interested in looking at all of the content that's available, it lists it here for you. So at the very top, you'll find the most recently published items. That could be anything, whether it's a topic page, blog posts, etc. And as you scroll through, you find all your research results. So you can find topics, fact sheets, events, blog articles, site pages, PDF documents, etc. If you wanted to narrow it down, if you're interested in learning more about forage establishment, if you were going to look in Google, you might type in a question, for example. You might type in, how do I complete forage establishment, or what do I need for forage establishment? For our search tool, it helps if you don't ask a question, and if you want to look up forage establishment, you type in those two keywords, and you should get some results here. So you'll see we have 2 blog articles, so you can jump right down to those results. We've got one here on forage establishment on a new web page, and one here on pasture one. So just a little bit easier way to find things on our page, but it can be a little bit specific if you don't spell your search term correctly. So for example, if we spelled it forage, we don't get any results. So try to be as accurate as you can when you're spelling some of the terms that you're looking for on the website, and you should be able to help you find what you're looking for a little bit faster. So that's all I had for that. And I'm going to hand things over here to Dr. Steve Hendrick, who you're really here to hear from tonight. So I'm pleased to welcome our speaker, Dr. Steve Hendrick. He is a veterinarian at the Coaldale Veterinary Clinic near Lethbridge, Alberta. Steve was raised on a cow-calf and feedlot operation in southwestern Ontario. He received both his DVM and Doctor of Veterinary Science degree in epidemiology from the Ontario Veterinary College. Steve worked as an associate professor at WCVM in Saskatoon for 9 years and provided veterinary services to cow-calf, dairy, and feedlot operations. Beyond his clinical duties, Dr. Hendrick also lectured to veterinary students and conducted research studies on a broad range of issues, which include Johne's disease, trace minerals, distiller's greens, mycoplasma pneumonia, and venereal diseases in cattle. Steve currently works at the Coaldale Veterinary Clinic near Lethbridge, Alberta, providing veterinary and consulting services to feedlot, cow-calf, and dairy clients. Outside of work, Steve enjoys spending time with his family in the mountains, hiking, skiing, and biking. And tonight, Dr. Hendrick will be speaking about the steps you can take to reduce disease in newborn calves. So with that, I'll hand things over to you, Steve.
Okay, great. Thanks, Ellen. I hope everybody can hear me there tonight. I guess if not, yeah, let us know. So the topic for tonight is steps to reduce disease in newborn calves. And to address this topic, my outline or plan for this evening was to start with some background on the topic. And so I think just to understand why this is so important, we'll discuss some of the diseases that newborn calves get. I'd like to have a brief, conversation about the impact of calving season as well. That kind of leads into the whole concept in my mind of disease balance, which is some ways that the balance between immunity and exposure and often dictates whether animals or herds are going to be healthy or sick. Okay, so from that background, then that's going to springboard us into a conversation around steps that we can take to reduce newborn disease. So the key steps in my mind are reducing dystocia, improving immunity, and decrease exposure. And so those are pretty broad categories, and I'll get into more of a conversation about each one of those points as we get into that. By all means, if there's any questions as I'm going here this evening, feel free to type those in and send them to Ellen, and we'll be sure to try and address all those by the end of the evening as best as we can. So during the, it's harder to have that type of conversation as we go here. It's a little different giving webinars rather than live presentations, but yeah, feel free to send in your questions, and like I say, we'll do our best to have a good conversation. So with that, I wanted to start off with, so in my mind, neonatal disease is a factor that impacts calf crop percentage. And just to be clear about that, that's the percentage of cows that get exposed to the bull that raise a calf to weaning age. And so to do that, the cow must become pregnant in the first place. Then she has to successfully carry the calf to term, give birth to a live calf, and then raise it to weaning. So there's a lot of steps in that process, and neonatal disease is one of the probably major reasons for losses in this whole process. So I guess at the end of the day, that's why we're having this conversation. We realize that if we're going to have calves to sell at the end of the day, we can't have neonatal disease eat our lunch. So it ultimately does impact the economics of our herd. And so that's sort of the beginning of why this is important. The next thing I wanted to branch into was just discussing some of the diseases that we see in newborn calves. So this first slide here was taken, or well, the information that I'm going to share with you actually on the next two slides come from some work that Cheryl Waldner and her colleagues at the Western College of Veterinary Medicine did back in the early 2000s. where they went out to 203 herds from across Western Canada, and they had the veterinarians associated with those herds submit any abortion, stillbirth, or dead calf that happened in the 2002 calf crop. And what was pretty amazing about this, they had a high uptake of receiving these dead calves and fetuses, and were able then to do a whole array of testing on them, which I'll share on the next slide. What I wanted you to take on this first slide, though, is that if we look at abortions, for example, they found in these 203 herds that there was about 1.6% loss that happened with abortions. Similarly, and more, was stillborns at 2.6%. And then finally, of the calves that were actually born live, there was about 4% of those that went on to die up to about 3 months of age. Okay, so when you look at that in total, we see, and it doesn't mean that every herd lost 8% of its calf crop percentage, but certainly that was the average value, and some would be more or less in each of these categories. So you can see that this would be, or can be, quite significant. Interestingly enough, they found that twins represented about 20% of the aborted fetuses. I don't think that's too surprising. Similarly, about a quarter, or 27% of stillborn calves were from twins. And actually 8% of the calves that went on to die, if they were born live but went on to die, 8% of those were actually from twins. And so we know that that can be a risk factor in dystocia. Similarly, I guess mirroring that is, did we have to assist that birth? 11% of abortions, right? And it's not something we frequently do, but it certainly does happen that if we have an abortion, we have to go in and help remove that dead fetus. Once again, by definition, with these stillbirths, about 50% of those were assisted, and 17% of the live-born calf mortalities were assisted. So from there, when they looked at all the different testing and that they did on these dead calves, they found in the stillborn calves that the main cause of death was dystocia. And I've got that highlighted in red because to me, that's a key thing, that one of the things we're going to be discussing throughout the evening here. Dystocia can have a significant impact. Sure, it's the leading cause of stillborns. I don't think that's rocket science. But then when we jump down and look at neonatal calves, we also see pneumonia. And so these are calves that are less than 3 days of age. And so having an infectious etiology is probably less likely. Some of the pneumonia is probably edema and probably cardiovascular effects of dystocia and some of the damage that gets done when calves get starved for oxygen. So to me, in my mind, dystocia has a significant impact, not on stillborn calves, but also in that early neonatal period. Next in line on the stillborn calves, you'll see thyroid gland lesions and myocardial necrosis or myopathy. So to interpret those, your thyroid gland is in the neck of the calf. If you think about it, that is probably the gland that's responsible for producing hormones that affect our metabolism. And similarly, the myocardial necrosis, what that means is heart muscle that's dead or dying, or having a myopathy, which just means the muscle isn't working properly. Similarly, you see in green also skeletal myopathy. That means that the muscles we need for moving aren't working properly, or they're dying with necrosis. Okay. All those, when they investigated those, were related to vitamin A and E and selenium. And what I'm trying to get after, anything that's got the green on this slide, is just indicating that these are probably nutritional issues. Okay. for one reason or another. Either we're not feeding the animals appropriately, or they're not getting the nutrients that they need. So just wanted to highlight that. Similar, I don't think it's too surprising that in stillborn calves, we see developmental anomalies or abnormalities that show up. So they maybe weren't severe enough that they were aborted much earlier in the pregnancy, but they show up just before the animals or the calf or fetus is to be born. When we jump down to neonatal calves, I've already kind of discussed with you my opinion of the pneumonia. I think it's probably very unlikely that it's infectious at that stage. I think once the calf gets older, for sure, we're probably dealing with something that is infectious. But once again, these calves that die very early, it was very common for them to find these skeletal and myocardial or heart issues in the muscle. And like I say, being of nutritional cause. Certainly we can see accidents or trauma, and we know that occasionally with mismothering or different things that happen or accidents happen. The next thing that's also on that list is septicemia. And if you think about that's basically blood poisoning, when we've got bacteria that are in the bloodstream and they're causing disease. So that typically happens with calves that get a high exposure to probably either manure and that gets ingested, or it comes in through the navel and gets into the bloodstream. So that is infectious, and that's why I've got it highlighted in blue. That shows up again in the older calves where we have enteritis or colitis. From a practical standpoint, we'd call that scours. The other main issue is pneumonia. And certainly, I think from a producer reporting standpoint, those are probably some of the most common causes of disease or death that we see. What was interesting in this study of Cheryl's was, or Dr. Waldner's, was starvation, abomasal ulcers or perforations were also, so there's some stomach issues or mismothering issues that are going on. So cow behavior becomes an important part of why some of these calves don't thrive after 3 days of age as well. And then we get into some of the intestinal accidents like a twisted stomach or a twisted gut or obstruction or another type of perforation or where the gut breaks open. So anyways, at the end of the day, their study found that the biggest percentage of loss was very early on. And so that's why we're having this whole conversation this evening, is to discuss, how can we prevent some of these issues from happening. And so, like I say, there's lots of studies where we survey producers, and that's a great value to hear what you're treating. What I find really interesting with this study is to have all the diagnostic testing that went along with it. There was the diagnosis that was made on site by the veterinarian that looked at some of these animals as well, but then being able to do some further testing is certainly of value in studies like this. All right, so the next slide here that I want to discuss is what I call the disease balance. And in my mind, we always hope we're in a healthy state, but a lot of that is all determined by, and even, it fits very well with a infectious disease model. Like if we're talking about calf scours, for example, we know that hygiene, it plays an important role. If our calves don't get exposed to the bacteria or the viruses or the parasites that cause the disease, then the risk of that disease is going to be quite small. We also know that nutrition of the dam and vaccination of the dam, or even the calves, whether the calves receive colostrum, what the weather does, and some of the other stressors can all play a role in affecting the overall immunity of the animal, and then ultimately whether they get sick. And so it's kind of those, in my mind, it's pretty simplistic. And sometimes we're somewhere in between. It may not be severe enough that the whole scale gets tipped over. I think sometimes we have what we call subclinical disease, where it's not bad enough that the animal is really, really sick and depressed or droopy or whatever you want to call it, but that it might be affecting production. And so it can be all different severity. And like I say, usually there's multiple factors at play, and sometimes correcting one of these makes the difference. And many times it takes bits of fixing all of these. A change in the weather can do that, just on, and so on and so forth. So anyhow, that's, in my, maybe this is too simplistic, but I think if, keep that in mind as we go through, the rest of my talk here this evening. So the last part of background that I wanted to talk about was calving season. And I guess what I'd like to say is I recognize that each producer on this seminar and out in the field, each producer has their own reasons for calving their herd when they do. And I respect that. I think, and so for the conversation, I've met with producers that would say, well, just calve in the springtime and you don't have to worry about any of these disease issues. And in some ways, I understand what they're saying for some of the infectious diseases, but there are other pros and cons that go along with that. So my goal here is to try and provide some generic comments and feedback or steps or suggestions on how we can minimize neonatal disease, and try to have it fit for many different producers. So some of my comments tonight won't apply if you're calving out on grass, and I recognize that in the spring, where it might have more applicability to winter calving, and we felt that was timely going into just coming up before calving season here. So I guess in my mind, though, the basic concept, whether you're spring or winter or fall calving even, is that infectious diseases are less common when cattle are spread out. So whatever we can do to make that happen, whether you're calving in the wintertime or the spring, that's going to reduce your disease transfer rate. So that's my strategy for all of you, or whatever you can do to reduce confinement. And it's tougher to do, I recognize, in the winter time, but it is something to keep in mind. Whenever we start confining cattle, that's where infectious diseases become more of a problem. So at this time, I've asked Ellen to, I think she's prepared a survey question for you. I'd just like to get some feedback on, for those that are participating this evening, if you could share with us, what your calving season looks like. It just kind of gives me a frame of reference of who I'm speaking to, and it'd be, would be good to hear. So if you could take this moment here and answer the question. So it is, when is your calving season? The first option is January through March. Second is April through June. The third option is July through September, or October through December. Or the final option is I have 2 calving seasons. And I probably should have had the Jeopardy song ready to play here. But I wasn't thinking ahead of time, guys. I'm sorry. But
okay, we have, most people have responded here, so I'll close that.
Okay, I'm not sure if everybody can see that, but it shows that 63% of participants tonight are calving between April and June, while 32% are calving January through March, with about 5% having 2 calving seasons. And so maybe, I'm not sure if they probably stretch into both of those categories then, or could, I guess. So with that, I mean, I think we are seeing a shift in I think traditionally winter calving was more common in Western Canada, and as herds have grown and I think definitely calving in the spring reduces typically the amount of labor and facility costs. Like I say, it does have some downfalls in the sense that you're often weaning a lighter weight calf as compared to winter calving. However, you may choose to market your calf after some there's all different permutations that happen. So I appreciate you answering that. It's good to know what, where people are at with that. So like I say, I think you could almost have a whole webinar discussing the pros and cons of calving season and but I want to leave it at that for now. But like I say, I do know that it influences, some of the neonatal diseases that we see. So the bulk of my talk now will focus on steps to reduce newborn calf disease. And so the first area that we'll discuss is reducing dystocia. The second point will be increasing immunity. So in that, we'll discuss colostrum vaccination, and then finally reducing pathogen exposure or infection pressure through hygiene. Okay. So reducing dystocia. I don't think I have to tell many of the producers here that are listening or watching this webinar that heifers are at the greatest risk of dystocia. And I guess in my experience, the dystocia rate in heifers versus cows is probably at least 2 to 3 times. And so, that's why we tend to pay more attention to our heifers calving. And I think the best way to do that, in my mind, is to breed and calve our heifers at least 2 to 3 weeks earlier than our cow herd. This does allow for more time for monitoring. It kind of gets us in the ball of, watching these animals a bit closer. I also really like it because it gives more time for those heifers to recover for breeding. We know that, for cows, that time period is often 60 to maybe 75 days, where on heifers, that can be even up to 90 days post-breeding, post-calving, before they're fully ready for breeding. And so it just allows a bit more time for that to happen. And then my idea is hopefully for the longevity of those heifers, that'll allow us to maintain them in our herd for longer. If we can keep them in that first cycle, longer before they start drifting further and further into the calving season and risk coming up open. So that's sort of the first point. I think probably the next point that a lot of people have we've figured out after the exotic craze way back in the 70s and 80s was the low birth weight, and using EPDs to try and identify what are the right bulls that we should be using on our heifers. And I think in the purebred industry, we try to do a much better job at figuring that out too, and having good data to share with industry. Of course, looking for low birth weight bulls, and some of those I think have shorter gestation period. So the idea is that they're calving a little bit earlier. Hopefully that calf isn't going to get as big, but hopefully still have some, decent growth rate in it. We often feel that the growth rate in utero often can match, some of the growth rate that we see post calving in these babies. And so we want to make sure that we have good growthy calves, and we don't want to end up with a bunch of small calves at the end. So having what we call as curve benders is probably what we're striving for to identify and make sure that we can have some good growth once they're born. Have them born small enough that it's easy enough on the heifer, but still do well. All right, so many years ago, pelvimetry came into fashion. And that's where we measure take some pelvic measurements. There's actually some instruments out there that you can use, or your veterinarian can use, to kind of measure the width and the height, or the dimensions of the pelvis. Those have been studied both in the US and in Canada, and the data or studies would suggest that pelvimetry is difficult in estimating or predicting all dystocias. I think because there's so many different causes of dystocia, and so being able to predict all the fetal or the calf and the dam size and whether there's going to be a mismatch is difficult to do. That we're probably better to focus on birth weight, and as long as we're not getting that too small that we're losing performance. So I guess what I'd encourage you to, and I've got a picture on here of a scale and a sling. I know that's not always done, especially we've got a lot of producers that are calving out on grass, but when possible, maybe grabbing some birth weights, not on every calf obviously, but if there's an opportunity to do a subset and get an idea, especially on our heifers, how are we doing for birth weights? Are we above or below where we were expecting, and how is that working for us? I think doing some of that might be of more value than trying to predict with pelvimetry. All right, so another suggestion for these heifers, and I'm throwing it out there, is the idea of sex semen. And I think heifers and breeding replacement heifers often have very good conception rates. And so if there's one place where producers might be interested in using artificial insemination, I could see using it on that type of group. And my suggestion would be, looking at spending some money on sex semen so you raise heifer calves. We know that in the dystocia group, and Cheryl Waldner's study there, that definitely there was a much higher proportion of bull calves that were born in the dystocia groups, okay, and stillborn groups. So sex does play a role in that, and if we want to make things easier, perhaps that's something you could look at. It's not perfect maybe for everybody, but it is something to consider. All right. I think another important point is to make sure that we're calving at a proper body weight. So we're trying to target 85% of what we expect that mature body weight to be. And what's really important is not to get these animals too fat, okay? Some would say calve at less than 3. I tend to be a little bit more flexible and maybe allow a little bit more flesh, but definitely less than 3.5, okay? To 2.5 is probably the ideal condition in my mind, okay? So to affect this, I think we really need to be cognizant about our winter feeding program. And what I really like to see in heifers is that we're allowing them to get some exercise. I know sometimes they do get dry lotted at times if they need be, but I really like to see more extensive grazing if we're able to do that, if that's at all a possibility, mostly for that exercise, okay? My thoughts, and it all depends on herd size. I realize that grouping cows can be a challenge if your herd is smaller, but I think as herds get bigger, I think keeping heifers, some of you, maybe your first or second calvers, and some of the skinny cows separate, being able to pay more attention, provide a bit more calories to them if they need it, and then do that sorting at pregnancy check in the fall. Okay, so it allows a bit of time to hopefully put some flesh on those cows, and make sure they're at the right condition, so they're not getting bossed around by the older cows. So those are some thoughts on how we can manage or reduce dystocia in heifers. I think across the entire cow herd, when we start talking about managing dystocia, it's detection, right? And what I really like in the last number of years is the technology that's coming along with camera systems, and being able to watch our cows without going in and disturbing them. I think is a huge benefit. I think that's, you know, not saying that hourly checks aren't of value, but I think in some herds that's pretty difficult to do. That's, you know, and if we're causing animals to slow down or stop their calving because they are getting disturbed, particularly in heifers, if they're a little more timid, that can be an issue. The cool thing is with some of these camera systems is that they have an infrared. I'm not sure if they all do, but some of them certainly allow for that. So even without adequate light, you can still usually make out what's happening. But of course, if you're checking manually, you want to make sure you have adequate lighting out in your calving area, especially if you're moving cows then to bring them in and check, and that we need to have appropriate facilities to do that. One of the suggestions, and I know it's more anecdotal, I think there is a little bit of research to maybe suggest this, is feeding calving cows and heifers in the evening as an attempt to try and get more animals calving during the day. I know it's not a perfect science, but it is maybe a suggestion or something that we can consider doing if it works in your system. And I understand that sometimes doing things late in the day, like feeding, isn't opportune either. So, all right. So finally, the last point on reducing dystocia, to me, in my mind, you need to know when to intervene. So if you see a cow that actively strains for 40 or 45 minutes with no progress, that is a cow that should be checked. Similarly, if 90 minutes have passed since the water bag first appeared, we should be checking that animal. If we look at this heifer on the slide, we see the feet are coming first there, and it looks like the hooves are pointed down. So that's hopefully going to be a forward calving with normal presentation. So, you know, at least that's what we'd be hopeful of. And that's ideal. But if you do see the hooves and they're pointing up, so the soles or the surface of the hooves are pointing up, either that's a backwards calf or it could be an upside down calf. Probably more often than not, it's going to be backwards, and it may or may not need assistance there as well. So keep an eye on it. If only the head or the tail emerges, of course, make sure that you check those out. If an uncalved cow is trying to mother another calf, that's another animal that we should probably be taking a look at. And then finally, cows that demonstrate, or heifers often, that demonstrate greater than 5 to 6 hours of anxiety. So almost stage 1 calving is what we'd say, where they're walking around with their tail extended up in the air. We should probably be taking a look at those animals as well. So that's kind of the checklist in my mind, that if you're wondering whether you need to intervene, these are what you should be looking at. So the next areas that I'm going to go into relate to how can we improve immunity, okay? And the biggest thing in my mind, and if we go back to Cheryl Waldner's study looking at calf mortality, if you remember the heart and the muscle lesions that we saw, a lot of those, like I say, were nutritional in nature. And so I really believe that if we're going to stop neonatal disease, we need to go back in time or start ahead of time. And I think that's why having this conversation today, even if most of you aren't calving till next spring, what we're doing today is ultimately going to impact your calving at that point. So what we're choosing for a winter feeding program. And to me, once again, that it becomes, and probably has been, a whole nother webinar where we look at there's lots of different options to consider. I think traditionally where cows were dry lotted, or I think more and more people are looking at options for winter grazing or extended grazing. And I think those make a lot of sense for different reasons. But like I say, we could have a whole debate and conversation around that. The point being, I don't care which one of those you use, you need to feed test, okay? And the reason I feel so strongly about that, we need to know what we're feeding. And We can have year-to-year variation in our crops that we're feeding, or crops or forages, if that's annuals or not. And I guess what's important, what we're feeding, but what we're not feeding, okay? And it's fine and dandy to get a feed test. The next important thing is to try and figure out, does feeding that at the amounts that I'm planning to feed going to meet the needs of my animals at the various stages of gestation or pregnancy, okay? And so the beauty is we can use a simple program like CalBites to do that. And if that's something that's beyond your interest or capabilities, you can definitely find people to work with that can help you with that. And I'd highly encourage that if you're not doing that, that's something that you'd consider. It allows you, in my mind, to plan ahead with appropriate rations then or feeds to match your cow's needs. So maybe rather than using a certain feed during the third trimester, maybe you're going to hold off and feed it to your cows after they cow because it's much more suitable to match their needs at that stage. Of course, we always have to look at the amounts of feeds available, etc. But in budgeting all that, it's more complex, I realize, than maybe how I'm picturing it here. But the reality is being able to know what you're feeding is very important. I've already discussed sorting cows by age and body condition, but I just wanted to highlight that point again because I think it's one of those things that often gets ignored, especially in smaller herds because it's just harder to do. But I think it can pay dividends. Okay. So with our winter feeding program, I don't want you to forget about including a good mineral program. Okay, and that means not just calcium and phosphorus and salt or that kind of stuff. We also need to be looking at our trace minerals. Okay, and with that, I'd really, have you either work with a nutritionist or an extension specialist or some, veterinarian, you name it, that can help guide you on looking at that and make sure you're meeting your needs. Some research that we did in Saskatoon when I was there would suggest that you need at least 75 to 90 days before calving, and often that mineral is fed and should be fed probably out till pasture time. I admit, yes, it's nice if you can have it out on grass, but often consumption can drop off and maybe it does become less important, perhaps, depending on your forages again in the year. So once again, I'm not suggesting that you shouldn't feed mineral more frequent, but work on a program that you come up and you're meeting their needs either on a weekly or twice a week basis, that you're getting some mineral out to them. Doesn't need to be daily. And like I say, I know sometimes if they really like the mineral, they're going to lick it up in a short time period. And so make sure you're budgeting that out. I think what's really important is that we're trying to manage body condition on our cows as well. So trying to establish that 2.5 to 3.5 by calving time. Okay. So I guess in terms of nutrition, I just can't stress how impactful it is on general immunity of the cow and the fetus. Okay. So it definitely does impact fetal development and programming. There's a whole field now devoted to that. We call it epigenetics, where we know that what we feed to our cows ultimately affects the genetics and the next, replacements that we're going to produce or the calves that we're going to sell. It also impacts quality of our colostrum as well as how much of it is produced. And ultimately, if our cows aren't in good health, response to vaccines is going to be affected. And so we just can't expect good health or good response to our vaccines in that case. All right, so that's going to leave nutrition now and discuss colostrum. So what I want to remind you is that calves are born with very limited acquired immunity, I would say. So they have the natural barriers. We've got our mucous membranes, our skin, etc., that all kind of keep bacteria on the outside as best as we can. but we know calf behavior. They try to suck and lick on everything. And so it's not very long until they have bacteria either in their nose or up their mouth, etc. Right? And so because they're born with limited immunity, we need to make sure that they get colostrum. So colostrum is that first milk that provides the much needed antibodies, okay? So antibodies are a type of protein that are often produced very specific to different bugs or pathogens. And so hopefully by having moms that have been in the environment that your calves are going to be for an extended period of time, they've been exposed to a lot of these bugs, and they'll produce antibodies or immunoglobulins that then can get transferred through the colostrum. Realize that this can take several weeks or a month or so for these antibodies to get deposited enough or built up enough in that udder and to form that colostrum. So that needs, that is important. It takes that time for that to happen. Calves need to get that colostrum within the first 6 to 12 hours. There's always been the discussion that it can wait till up to 24 hours. It can happen, but we know the absorption is much, much, much less. And of course, it's greatest right after they're born. So if we can get colostrum into these calves sooner, the better. I realize that, definitely for those calving out on grass, we can't usually impact this, that we're just hopeful that when we drive up and we see these pairs, that mommy's got some, that her teats look shiny and look like she's been sucked, and that's all we can hope for. And so it is difficult to guarantee. It's not like the dairy calf where we, basically where they might get bottle or tube fed, colostrum directly, and they know exactly how much they receive. So it is different, but it is something that we need to be aware of. We recognize that if we go and we measure the blood of newborn calves, that approximately 10 to 30% of calves experience what we call failure of passive transfer. So that's where they don't get enough colostrum. So that can be quite large. These are the calves that are then going to be at risk of getting sick or diseased, okay, by not having those. So those are, if we could tell which animals those are going to be, and we'll have some more conversation about which ones those are likely to be on the next slide. What I'd suggest for producers is that we're assessing udders at calving. So if you're keeping a calving record to write when a calf was born or calving book, make sure we're also trying to score bad udders. That's the perfect time to recognize them. I would suggest that we call those cows in the fall, whether they're pregnant or not, unless you're really desperate. So if we see cows with big teats or low-hanging udders, that we're more critical of that. It'll make your job next spring a lot easier if we manage them in the fall. Certainly the quality and the quantity of colostrum or the antibodies in the colostrum is affected by the nutrition of the dam, the age of the dam. The older she is, generally the better it is, and then vaccination history and exposure, etc. So in terms of colostrum intake, we know that calves that are affected by dystocia, so if they've had a calving problem, so twins are often a good example where one or both calves may have been stressed trying to get them out. If you have a calf that's born with poor vigor, I'm going to say, or describe it as that, so that's a calf with a poor suckle reflex, or maybe it's one that's been chilled if it's born on a cold evening, or one that's just been mismothered, that mom had her and walked away. These are all calves that need to be supplemented, okay? And I think the best thing that we can use is probably, or simplest, is a commercial colostrum replacer. Those can be bought or purchased and then mixed up or blended to get them the right consistency and temperature, and then get them into the calf. Usually tube feeding is the best approach to do that. My preference for these commercial replacers is because that way we know the biosecurity risk as compared to trying to get a dairy, next door, getting some colostrum from them. I hate to say it, you just don't know what other diseases that they may be carrying. So Yonis would be a good example, or BVD, etc. Not that those are always highly rampant. I'm not trying to run down your neighbors, but just be aware of the biosecurity that goes along with that. If you're game for milking out your cow or heifer, go for it. But in many instances, it might be easier just to use a colostrum replacer. And like we said on the slide before, trying to get it into that calf sooner than later. Don't wait till the next day. It's one of those things that probably needs to get done pronto. In my opinion or experience, I've seen that calves born from tough calvings can benefit from receiving a long-acting, we call them non-steroidal anti-inflammatory drug, or NSAID. So common drugs like that would be meloxicam or Medicam, Banamine. Those are some of the trade names or products out there. Basically, those are like ibuprofen or aspirin for cattle, right? And so we use those to try and either, reduce pain or make them more comfortable. So I think there's real benefit, not only to the mom, if it's been in my case, if I do a C-section on the heifer, I find that's really beneficial to make that heifer feel better, so she's more likely to take her calf. But often even to some of these stressed calves, if they've been pulled, etc., they can be sore, and this is something that we can do to kind of make them more vigorous as well, and hopefully want to suck and take off for you. I should have pointed out that the bar graph that's on this slide here is basically showing the concentrations of immunoglobulins, okay, or IgG. It's one specific one. And in Cheryl's, is another one of Dr. Waldner's studies, she found that there was a significant relationship that the calves that died definitely had lower levels or had a higher rate of failure passive transfer, okay? And definitely, and it did relate, if she looked at all the treatments, that was also the relationship there, that the calves that got treated were more likely to not receive enough colostrum, okay? So related to colostrum intake, again, is mismothering and that whole point of failure of passive transfer and starvation. So we could have a whole nother conversation or webinar, I think, on grafting or, grafting a twin or an orphan calf. There's lots of different strategies that people use, whether you're into skinning calves or whether you're using Vicks Vapor Rub, who knows. But there's lots of different strategies that people use. I think I think the reason why there is so many is a lot of them do work if we give them enough time. Sometimes, one of the strategies I've seen people use successfully too is just putting that heifer or cow in the chute and allowing that orphan calf to come up and suck. And if we keep them separated, they can see each other, but not directly smell. If we do that enough times, usually that cow becomes relieved by having that calf coming and nursing that udder that they eventually, or within a short time period, it's surprising that they'll start accepting that calf. So just another strategy that I've seen or used in the past. Okay. Also related to immunity now and colostrum, actually the last topic is vaccinations, okay? So I think the cow herd vaccination program can help reduce pregnancy loss, whether that's abortions or neonatal sickness, okay? And so, but what I want to point out, it's kind of like the winter feeding program. Trying to vaccinate today and hope that we're going to prevent all the diseases down the road probably isn't the best program. It's having a strategy that you work with your veterinarian. So the diseases that we're trying to prevent, I would say with vaccination would be infectious bovine rhinotracheitis, that's a herpes virus. it causes, you know, pneumonia and can cause abortions in the last trimester. Okay, and so trying to vaccinate for that, often, you know, there's different trains of thought on what the best timing of that would be. And so work with your veterinarian to come up with the best strategy for that. BVD is another virus, or bovine viral diarrhea virus. So calves are often, or the fetuses are infected during early pregnancy, early to mid, and then they're born as carriers or chronic carriers. We call them persistently infected, or PIs. The bad part is then they're born, they basically recognize that virus as normal. Then when they're born, they cause sickness and disease in the other healthy calves. So they bring down the immune system of the other calves as they try to fight it off. So they themselves don't look necessarily sick, but they're shedding. So they're kind of like that Trojan horse or Trojan calf, okay? So we want to try and prevent that from happening. And so the important thing is cow herd vaccination to do that. My preference, of course, is pre-breeding, but I do understand the practicality of trying to, you know, perhaps do it at preg checking or other timing, but those would be, in my opinion, probably the less preferred times, but it is practical. All right. The other disease, of course, that we like to prevent is scours. And I think that makes a lot of sense in many herds, but not necessarily needed for all groups of animals. So I think one of the groups that we see a higher risk of scours is often in calves that are born to first calvers or heifers. And so that might be a subpopulation that you vaccinate. In some herds, if you're calving in January, February in confinement, then that's, you know, maybe you would choose to do the whole herd. And so realize that when we vaccinate for scours, that we're preventing against diarrhea caused by E. coli, and it's a very specific strain. It's K99 strain, and that is very common strain, so it does make sense to do that. There's also specific strains of rota and coronaviruses, as well as another bacterium called Clostridial perfringens type B. And so I put on the slide, just realize that this vaccine doesn't prevent against coccidiosis or cryptosporidiosis or salmonella. So those are all different causes of calf scours, and there's many different causes out there. And so just realize that, yes, we can use the vaccine. It can help if it's due to the causes that you're actually are included in the vaccine, but not for some of these other ones. So we need to use other techniques to help control those. Of course, scours vaccination is, you know, it's all fine and dandy if we're vaccinating our cows for scours, but then if the calf doesn't get enough colostrum, then that vaccine isn't doing any good either, or limited value, okay? So it is highly dependent on having good colostrum intake. There are differences in the scours vaccines that are commercially available. I think they're all decent products that are out there, but just realize that there are some differences in the timing of the different products. So make sure you work with your veterinarian to come up with a protocol that the timing is going to work for you. And so what that is relative to calving, whether you want to be able to give those vaccines within a month or within 6 to 8 weeks of calving. There's some different options out there for you. Some prefer to do it closer to calving or not, depending on their facilities. And I know in some cases, people are nervous running pregnant cows through the chute at the best of time. And so just be aware that there are some options that way as far as timing. Okay. Also related to immunity or vaccinations here again is some of the newborn vaccinations. And so, like I said to you, calves are born without immunity, but then they need to take in that colostrum. And so one of the ways that calves then develop their own is they get exposed, and so then they get the acquired immunity. if we give a vaccine in the muscle to a baby calf, it's been felt or shown that some of the antibodies that come in the colostrum will bind up that vaccine. And so kind of will negate, giving a vaccine in the muscle at that time or under the skin, okay, or parenteral, we call it, administration of the vaccine. So that's why companies have started to work towards making intranasal vaccines with the thought that you're providing localized immunity at the site of infection. So far, what we have is mainly vaccines against respiratory viruses. So I guess what I'd suggest, if you're calving in the winter months in particular, and you do experience newborn or early viral pneumonias, that this might be something that you might consider. In my opinion, I've seen herds that have some success with it and others that don't. So I think it's all dependent on what virus, like I say, there's 3 main viruses that are included, or 2 or 3 viruses, depending on the intranasal that you're looking at. And so it all depends if those are the ones that are causing issues in your herd. So like I say, there's these are options if that's something that you need. Like I say, the whole concept here is that we're trying to avoid maternal antibodies and get around that. So scours vaccination at birth. That is an option. There are vaccines available that you can give to your newborn calf. My gut feeling or my impression has always been that these are of limited value. And the reason I say that is that unless that calf is getting sick at maybe 2 to 3 weeks of age, there's not enough time. Even if you give the vaccine at birth and the calf mounts an immune response, that often takes 1 to 2 weeks until it's at maximum value. And so trying to give an oral vaccine to a calf against scours, I'm not saying in some herds people get desperate when they're having an outbreak and they reach for it and they use it and they feel like they've certainly seen some value of it. I'd say by and large, most herds that we see that are vaccinating against scours vaccinate their cow herd. And to me, that makes more sense overall, that if we do it the right time, we give enough time for antibodies to develop in the udder, and then it's in the colostrum. And as long as our calves are getting enough colostrum, that's probably our best attack. But it is another option. And like I say, there's actually other supplements out there of different antibodies that you can purchase that also help try to supplement some of the antibodies that they get from colostrum. So if we've got calves that need more supplementation, that's something that you can do in high-risk groups. So I think those were all, my previous conversation on nutrition and vaccination, etc. all, was talking about how can we improve immunity. Now I'd like to switch gears and talk about exposure. So in simplistic terms, my opinion is, and that's one of the values with spring calving, is often we just naturally reduce density, okay? By allowing cows to disperse on a larger, quarter section or whatever. By doing that, that allows them to spread out and it gets the disease transfer a lot less. I guess what I'm challenged at is how can we do that when we're calving in confinement? And I know that's tougher to do, but one of the things I'd really encourage if you're not doing is look at having a separate nursery pasture, for new pairs to bond. And so once they calve, get them out of that calving pen, so they're less likely to pick something up, but hopefully move them to another pasture where things are cleaner, where they can pair up and carry on. And they don't have to spend, eternity there either, but hopefully just continue to get moved on and hopefully keep the density down in your calving area. So one such system that was described and referred to as the Sandhills calving system. So that comes out of the Sandhills region in Nebraska, and what it describes is moving non-calved cows, or so cows that still haven't calved, to fresh ground every 2 weeks. And the whole idea is that we're limiting exposure, where that way they're calving on clean ground, and that way hopefully the calves that are born are kept more in a consistent cohort. And if disease does break out in one of those groups, it's limited to that age group, to a 2-week time period. And that type of system, and then the whole idea afterwards is kind of to gather those groups up again once the calves are a little bit bigger and have a bit more stronger immune system. But to do that, it requires having a lot of, I'm going to say, facility or pastures or paddocks to do that. And so that becomes the downside or the difficulty, but that type of principle works very well. Okay. My next point is, I think you can take it, is bedding. To me, that's always cheap medicine. Now, I admit it's not always as cheap as we'd like it to be, but certainly is of value. So, my motto always has been is dilution is the solution to pollution. So whenever we can cover up cow manure or keep it frozen, etc., I think, you just keep it locked, and the risk for infection is going to be a lot less. Along those lines is make sure if you are calving in corrals, that you're getting those cleaned yearly. Just sunlight alone isn't enough. I think if we can get things cleaned out, get some fresh dirt again, hopefully you're cleaned up and ready to go. Doesn't mean that we're putting disinfectants and spraying or liming and all that kind of stuff. I don't think we need to go to that kind of extreme, but just making sure that we get things cleaned out, get some fresh bedding in, can do a lot of wonders. Having a separate calving and wintering ground, and that too, when we're in confinement, can be difficult, but that's something to think about. In a perfect world, if we could change locations periodically, and that becomes tougher and tougher with winter calving in my mind. But if you have multiple paddocks where you could potentially keep them for the winter and then calve in different ones, different years, I think that would be of value. A real key thing to think about is do not keep sick cows in the calving pens, okay? Do not do that. In a prior time, I did a lot of Yoni's work, and that was one of the key things that we saw is producers would see a cow that wasn't doing well. I'm just going to sort her off and we'll feed her better, and they'll put them in the calving pen. And next thing you know, you've had this Yoni's cow that's been spreading manure all over the place. And as you can imagine, then infecting that calf crop. And so it can make a real disaster real quick if you do that. In terms of exposure, if you're calving in an area in winter calving or late spring or early spring, if you have the option to get in there and move some of that snow before you calve, that can do wonders. As you know, if we get a big thaw, it releases all that moisture and can make a real mess in a hurry. So to me, plan ahead and trying to minimize contact. If you know there's areas where water is going to run, if you can at all fence that off, that's not always possible. I get that, but make plans to try and do that. If you've got a hole that's going to fill in with water with snow melt, if we can keep the calves out of there, you'll minimize a lot more scours by doing that. Another point that I have here is feeding Menensins in the last trimester. That kind of goes back to feeding as well. In order to get minerals in, we can also try to get a product like that in. Menensin is a coccidiostat, so it'll help reduce some of the shedding in the cows. By doing that, hopefully we reduce the infection pressure during the calving season as well. There are other products out there. The broad category comes from some of the yeast products. So they're called monooligosaccharides. I think that's the cell wall from the yeast that gets fed or used. And the idea is that will help bind up certain bacteria. Similar to that is kind of the diatomaceous earth thing, and it's sort of the same type of idea or concept behind that. I'll be honest, I'm not huge advocates of either one. I'm not saying that they're bad or wrong. I know some producers have a lot of luck with them, and if that works for you, fine. That's great. What I struggle is you know, there isn't a lot of science behind them and whether they're cost effective, but you know, if it is something that's worked for you, you know, so be it. As long as I don't think they're doing any harm by any stretch other than maybe economically. So just something to think about, be aware of. But like I say, every herd is different, so I'm willing to keep an open mind on that. With exposure, if we have calves that get exposed to cold temps, making sure that we have a hot box to get them dried off. Of course, if they're really severely chilled, getting them in some warm water is probably the quickest way to get them warmed up, but then we need to get them dried off, right? And a hot box works very well for that. And there's lots of creative strategies for making these, you know, you can buy them commercially. Just be aware that these chilled calves are much more likely to not be able to suckle and more likely to have failure passive transfer. So make sure that these are the calves that get supplemented with colostrum. Related to environmental protection is, you know, I think it's nice to have some wind protection. I come from southern Alberta. That's my context where it is very windy. The thing we want to avoid is crowding. Like I said, anytime you get cows and their calves crowded together or confined, that's when we get into, you know, disease issues. So I've got pictured on this slide, we call it sometimes, or joke, call them the calf condo, where there's a creep feeder inside, etc., for the calves to access. Of course, this would get bedded and such. What I like about this type of shelter is that you can see it's kind of on skids that you could drag it or move it to a clean location to keep things clean and hygienic. So moving it even during a calving season, if you're at all possible. I realize things get frozen, etc., and that's not always possible. But if we're able to do that, or certainly adding bedding helps. But like I say, we just want to avoid not having too many pairs and calves inside, because what I like about this one as well is that, you know, it's got a high enough ceiling. So if there is, you know, hopefully the air quality remains better. If they're too low, I worry that, sure, it helps keep them warmer, but certainly can, you know, make poor air quality. All right, the next point on my slide is feeding hygiene. And of course, if you're, you know, going out and busting bale, or, you know, feeding bale, feeding on the ground, that's fine. My suggestion is make sure you're changing locations or sites. So you can maybe go back and revisit a site if you get some snow, or, you know, got it clean again, but ideally moving as much as you can to keep the infection pressure lower. I don't know how many times I've gone out and seen scour issues, and that is a common denominator of how they're feeding, and just being aware of drainage, right? Looking at your site and see where are there potential issues there. Some of the last final points are just isolating. If we've got a sick calf, once again, don't leave it in the calving area. Try to have a separate area where maybe you keep your sick calves isolated and separate, so that they're not going to be contaminating the calving area. If you are treating sick calves or scouring calves or anything with a tube feeder, etc., make sure that you're properly disinfecting those. Those are common causes of spreading infection as well, and so just something to be aware of. So in summary, for tonight's talk, hopefully I was able to convey that newborn calf mortality can have a significant impact on calf crop percentage and ultimately your herd economics. And that's why we're talking about it. The steps or strategies that I think we need to consider is we need to reduce neonatal disease. We need to manage dystocia. We need to have a good feeding program, as well as an infectious disease or control infectious disease through vaccination and hygiene. And I think ultimately many of these strategies, as you probably saw through my talk, are all interconnected, and it's hard to tease them all apart. But at the end of the day, if we do most of these right, we can end up with some healthy calves and make our lives a lot easier. So yeah, that was the talk that I prepared for you tonight. And so I guess with that, I'm open if you have any questions or comments or discussion that you'd like to have. Before I finish here, I would like to acknowledge and thank Ellen again for the opportunity, and the Beef Cattle Research Council for this opportunity to speak to you tonight. Hopefully, you at least found one nugget of information that I provided to you. That's a benefit. I'd also like to acknowledge Dr. Corey Davis. It's a colleague of mine that gave me some feedback and help with this presentation as well. So I guess at this time, I'd ask Ellen if she wants to take the floor, and we can maybe address some of the questions that you've had.
Okay, so if you have any questions for Dr. Hendrick, you can add those in the question area there at the bottom of your screen. One of my, oops, let's switch this. You had talked about intervening during calving and when to intervene. When or how can you make that decision of when you should be calling a vet or an expert to help you out with difficult calving?
Yeah, excellent question, Alan. So just to make sure everybody caught that. So at what point do you need to call a vet if you've got a dystocia or trouble calving? And I guess, so in my thoughts, there's I guess there's maybe three ways, I guess you could say, a calf can come out normally, right? So it's the normal frontward diving position, right? Where you've got front feet and head coming, or coming backwards with, hopefully just the tail up and the feet coming backwards. The other option, of course, is maybe a C-section. But the point that I want to make with that is if you get a calf that's coming frontwards and you've got the head and the feet and everything's all in the right position, and you're trying to pull and you've got two people and you can't physically budge or bring that into the pelvis, then you've got an issue there, okay? What I was often taught by veterinarians that kind of mentored me is just reaching in and having a feel of where those shoulders are and how they're engaging in the pelvis. And sometimes if you're able to pull one front foot and then pull the second one separately, sometimes you can get that calf engaged. But just because you can doesn't mean you should either. Occasionally you will run into problems that you end up pulling a calf that maybe you shouldn't have it. But like I say, if you get to that point that you can feel that those shoulders aren't properly engaging because it's too wide, well then I would say that's probably a good point. And and if two people are hooked onto that calf and you can't engage it or pull it, then definitely that's something that is going to probably need a C-section to get it properly calved out. If there's obviously a malpresentation, meaning you can't get the calf into one of those two normal presentations, either coming frontwards diving or backwards, then obviously that's something that you need some assistance with. Trying to pull a calf by one leg doesn't work if the other leg is back. So we always need to, get it into one of those. It's pretty simple. It sounds simple practically, but sometimes doing that isn't always easy, getting it into one of those two presentations, okay? So I don't know if that helps, Ellen, but if that answers your question.
Yeah, that's perfect. Can you repeat about avoiding maternal antibodies with the newborn calf?
Yeah, so in regards to vaccinating, like I say, we know that the antibodies that a calf gets are probably going to hang around for that first 2 to 3 months, right? That they're gradually going to wear off. And at that time, we also hope that the calf's immune system is developing its own antibodies. And so it's during kind of that time period that we're always kind of like, especially earlier on. So, vaccinating baby calves, in some ways it's way more, for guys that are calving out in April, May, June, that's an easier time, to actually grab those babies and vaccinate them. And so I can see where some of these intranasal vaccines that allow for that are very attractive for them. I think you're maybe a little bit limited on what you can cover off, but then following up, of course, maybe at weaning time, or if you do get a branding in between there, that would certainly be beneficial. But the whole concept is that, hopefully the calf's getting antibodies from mom against a lot of these different bugs that we vaccinate for. And so if we stick the same vaccine into calf as a baby, maybe we're doing, I'm going to say, a bit of harm in the sense that it's using up those antibodies against the vaccine. I still think you do get some immune response in that calf. And so I'm not trying to say that it's totally a waste by any stretch, but it may not be doing as much good as we think. It is what I'm gonna, is where I would leave it at. So just be aware that there's always that balance, that it's not that mom's immune or the maternal antibodies are bad. No, that calf needs those. That's critical, but it can be counter to giving vaccines as a baby calf. So, like I say, intranasal has kind of been one strategy to get around that.
Perfect. Is there any increase of vigor or an increase of mortality with F1 calves or other hybrid genetics?
Yeah, so the question is if we use F1 genetics, do we see more vigor or immunity in those calves? And I think I'm going to answer that with yes. I think that, and I'm not saying that staying with purebred, continually over time that you have decreased immunity. No, I think you can have very good. But whenever we start crossing with some other genetics, there's the opportunity to find some synergism that in different genes that could perhaps enhance or make things better. And so I think that's ultimately that happens. Now, is it big enough that you're going to, always notice that they're always going to be better or healthier? I think that's one part of the equation. Like, don't get me wrong, I think genetics are important, but I'm also a big believer that environment drives a lot of that as well. And what I mean by that is, we can do all we want for immunity, but if we've got a poor environment that we're keeping our animals in, our results could still be poor, even though you've done all the right things with vaccines, etc. So sometimes what I'm saying is with bad weather challenges, right, that are totally beyond our control, despite all the things that we've tried to do, you can still have some bad results. And even with crossbreeding and that, I think people acknowledge that there is some hybrid vigor, and that probably does extend to immunity as well. But it only does so much is what I'm trying to say.
Perfect. I've got a bit of a scenario here for you. I'm looking at buying a 75 cow herd that has never been vaccinated. I'm planning on doing a preg check next week. They're possibly April and May calvers. Can I start vaccinating now, and can I feed at this? I can feed at this farmer's location for another year before incorporating into my herd.
Okay. Yeah, no, so that's, I'll try to make sure I cover off the question. So to me, if you are buying animals that you don't know the vaccine history for and they're pregnant, I would not use a modified live vaccine. I couldn't in my right mind tell you that. So I would suggest finding a killed virus vaccine. That would be the safest to give them initial dose. Ideally, they would get a booster with that. Just realize that if they truly haven't had any vaccines, that would be the best program is, and that's the downside with killed vaccines is you definitely need to give them a booster if we want them to be maximized. So that, the first dose could definitely be given here at PregCheck, and maybe you're going to consider doing some scours vaccination. So perhaps you could spread that out and maybe do a booster and give a scours vaccine at the same time. That might be a suggestion of something to consider. Once they have calved out, I won't lie, my preference would be then to get them onto a modified live program where you do something pre-breeding. And like I say, that's not always everybody's preference. And so if you continue then in the fall with that preg checking, if that's your preference on vaccinating, then work with your veterinarian. I guess I'm a little cautious telling you to switch to modified live. If in some cases, if we stay within the same product line or the same manufacturer of the vaccine, the killed and the modified live are similar enough that they might feel comfortable doing that with you. In other cases, if you're completely switching lines, that may be a little detrimental. So once again, I just advise maybe touch base with your veterinarian before you do that part of it next year on how you address your vaccinations that way. But and like I say, I don't know for the rest of your herd if what type of program they're on, but so I'm not sure, Ellen, if I've got that question covered or that was there a second part to it? Okay.
Yeah,
no,
I think so. Okay, I think we'll just do a couple more here.
Okay.
Do you have any suggestions for a protocol if you were to purchase a replacement calf? So let's say you lost a calf and you brought one to your farm. Is there anything that you would give to it once it was on farm? Vitamins or something like that?
Yeah, that's a great question because and I'm glad they brought that up because I had meant to, this whole concept of biosecurity, I guess, that comes into play. I think that was actually in the last question a bit too, of keeping that herd isolated from the rest of the herd. In some ways, that's a smart move if you're ever able to do that, even, or purchasing bulls, etc. Calves is a real tricky one. I feel bad saying this. In a perfect world, I would probably avoid ever purchasing, newborn calves to fill. I always feel bad when you see a mom that loses her calf and you don't have one to take its place or to foster. But going out and getting another calf can be tricky. Now, I suppose if you're aware of the herd that you're buying, if you're getting another beef calf from a neighbor and you're aware of how they're managed, and what their vaccination status has been in their herd, maybe you're comfortable with that and maybe it's not a big issue. But I'm not trying to pick on the dairy industry, but going and buying a Holstein calf, and once again, I'm not trying to paint a picture that they're all disease rampant herds, but whenever you bring new animals in, you're automatically going to bring slightly different strains of some of the same bugs that you might have. But when they come into your herd, they can cause disease. And so the tricky part for me is, do you give them an antibiotic? Do you give them vaccines? I think you can do a bunch of those different strategies. That doesn't guarantee that they won't create sickness in your herd. Okay, so they themselves may not get sick in your herd, but they might bring in something. And so it's always hard to make sure that they're completely clear. So maybe a wise thing, if you're going to bring a calf in and foster it on a cow, maybe there is a way of putting her and that calf and quarantining them almost for a week or two to make sure that that calf stays healthy. As you can imagine, if you've got a stressed calf trying to get it fostered, maybe that becomes, you know, if it gets sick and starts shedding. So yes, you could look at the same types of vaccines that we discussed, maybe some intranasal, maybe something else, or perhaps an antibiotic if it needed it, if we could justify that. But so those are just some thoughts or considerations that I've got based on that question.
Okay, I think this will be our last one. What is the main cause of navel illness?
Yeah, that's a great question. So one, you know, I think the hard part for me to say the main cause is some might argue, you know, it's how that placental tears, and maybe, you know, there's probably multiple factors that go into that of how it separates. I think in some animals, if it tears really short and you leave a bit of a hole there for the calf, that can leave, you know, open, you know, a spot for bacteria to get in, right? In other instances, you might have a dam that continuously licks it and keeps it wet. They're trying to keep it clean. I think some of the big factors in my mind is hygiene, and you may not like me saying that, but I think if you're running into a large number of umbilical abscesses or navel ill, that's something that I worry about, as well as failure of passive transfer, that we're not getting enough colostrum in. So, you know, are the udders clean? Are, are they, do we have cows that aren't maybe making enough colostrum, or maybe it's poor quality? So a lot, it's always multifactorial. It is rarely that I could point to one thing that, and does, I'm not a big believer that dipping navels is the best way to control it either. So like I say, as far as naming one thing, boy, that's a tough thing to say, because it rarely is. There's usually multiple factors at play. And I guess if that's the one thing I could convey in that, it's rarely that simple, right? We all wish it could be that you could just change one thing and it's going to make everything better. But I think in reality, that's tough to do. So, there again, those that calve in the spring, I admit they probably do see less of them because it's a cleanliness issue, right? And if we can keep them on clean ground, so however we do that, that to me is the highlight. But like I say, it's multifactorial. So.
All right. So there's just a couple more things before we let everybody go here. One is how to get more information and science-based production advice through the BCRC. You can go to our website, www.beefresearch.ca, and click the subscribe button to sign up for our free email list, which includes our new e-newsletter, The Wire. You can follow us on Facebook, Twitter, and on YouTube. You can connect with us there. And our next webinar will be after the holiday season. It'll be on January 16th, and it'll be a panel of veterinary insights from across Canada. Our speakers for that webinar will be Dr. Werner Duberton from the Provincial Vet Service in New Brunswick, Dr. Jenna Funk from the Metzger Veterinary Services in Ontario, and Mike Jelinski from the Veterinary Agri-Health Services in Alberta. You'll receive an email from me in the next couple of days with a link to watch the recording, as well as links to some additional information on neonatal health, calf health. You'll also receive a link to the survey. If you can take a few minutes to fill out the survey, it helps us with developing the future webinars. And that is it for us. I'd like to thank you again, Steve, for taking your time to join us this evening on behalf of the BCRC. And that's it for us tonight, everybody. Well, good night.
Thanks, Ellen.